There are multiple ways to secure a central line. They are often needed for several days or weeks, so securement is important.
The most common method I still see for physician-placed non-tunneled CVCs, like in the internal jugular vein, is sutures. The neck is usually an awkward site with movement and hair growth that decreases securement. This is probably why sutures continue to be the primary securement method often seen despite recommendations against their use. According to the Infusion Nurses Society, sutures should be avoided due to an increased risk of infection, needle stick injury, and biofilm growth. Adhesive securement devices usually clamp or hook the catheter, and often that's how PICCs are secured. So on the right-hand side, I've got a video of how you correctly apply an adhesive securement device. So in that top one, want to make sure that you follow the picture. So it actually goes above the hub. If you try to put those butterfly wings where that hook is, you're not going to be able to secure that catheter. With this hook type, you slide those little catheter pigtails underneath the hook, and then there's a tape strap that you can pull across. When applying these, you want to be really careful that you don't accidentally dislodge the catheter. The other type actually hooks around the wings. So with this type of device, it's got little pegs that go in the holes on either side of your catheter hub. And then it has little snaps that go over, locking that in place. Really good idea to use barrier film or skin prep and letting it dry, so that way these types of adhesive devices will stick better. Ensuring the line dressing or additional dressing like a transparent semi-permeable membrane also covers the securement device will help promote better adhesion.
There are integrated securement devices where the dressing is combined with built-in securement technology. And there are some promising new securements that are less commonly seen, like the SASS, or Subcutaneous Anchor Securement System. There's even tissue adhesives like cyanoacrylic glue that glues the thing in place at the insertion site. So SASS has little feet that are placed under the skin right at the point of entry. And the SASS doesn't need to be replaced like other securement devices during dressing changes. Tissue adhesive glue can be used as a securement adjunct to temporarily bond the catheter to the skin at the insertion point and seal the site off. It has the added benefit of immediate hemostasis, which prevents bleeding and the need to change the dressing sooner. Tunneled catheters have a different mechanism of securement under the skin. They're usually tunneled several centimeters under the skin before accessing the vein. They have a cuff near the exit site. It looks like a small white cylindrical device around the catheter. It resides under the skin to anchor the line. Tissue adheres to the cuff, forming a subcutaneous anchor, and once healed, the insertion site will be sealed. If you ever see a cuff, notify the physician immediately.
So in the first picture, we have this examples of adhesive securement devices. In the second picture, I've drawn a diagram of what an integrated securement type dressing might look like, and you can see that it has some features built into it. In the second row, I've got two pictures of a subcutaneous anchor securement system. So as you can see in that first picture with the orange border, you can see the little feet going along with the catheter under the skin, and you can lift that catheter up and scrub around it. And then the next picture shows that the anchor system is actually attached to the catheter and secured under the skin. So when should I change a dressing? When it's loose, soiled, and or dirty. So soiled to me means pretty darn dirty. So that picture in the bottom right corner is clearly a dressing that is loose, soiled, and dirty. If there's a small amount of blood around the catheter, you're going to want to use your clinical judgment on whether or not that should be changed. Keep in mind, chlorhexidine sponges and gel pads can absorb several times their volume, and they, according to manufacturers, they still provide antimicrobial protection even if blood's present around the gel pad. However, if there's a significant amount of blood, you're definitely going to want to change that dressing. You want to change the dressings a minimum of every 7 days. If it's a gauze dressing, it should be changed in 48 hours. We want to make sure that chlorhexidine pads or sponges or an antimicrobial is providing 360 degrees of coverage around the insertion site. And we want to use skin preps and barriers and let them dry. That'll help the dressings stick a lot better. So the top right shows a dressing that is correctly dressed. You can see it has antimicrobial qualities. There's a small, tiny bit of blood around the insertion site. It's labeled with the external length, and it has the next dressing change date. And the securement device is totally covered, and we can see the entire catheter and insertion site. The dressing on the bottom left side has a few potential issues. One, the catheter is close to the edge, so if that dressing peels up, the catheter will be exposed. Also, the exit length is pretty long. I would want to double check my insertion notes in the medical record if I saw a catheter that had this much length. That much length is going to be difficult to fully provide a good dressing coverage, so you may need to use an additional transparent membrane to provide good coverage. It's a good idea to make sure those securement devices are also covered with the dressing. I've seen those detach and come off the skin. If those things detach, then there's really not a whole lot of securement, and that dressing could become dislodged. And then that bottom right, a bunch of issues with this one. The dressing's peeling up, it's clearly been in place, the catheter's kind of kinked underneath the dressing, the securement device is exposed, and there's no antimicrobial disc or sponge or dressing on this catheter as well. So if you see a dressing like this, please change it immediately.
For most lines, a dressing alone is not enough to ensure securement. Dislodgement is a common problem that results in the need to replace lines, increasing patient risks and costs. If the catheter has too much movement at the insertion site, it can also cause irritation to the vein, surrounding tissue, and skin. A tubular stocking or arm covering can allow easy access and examination of the site to help protect the dressing and catheter. Rolled bandages are not recommended by INS to help secure dressings.